Ozempic causes you to go blind and destroys many lives, says this ex-user. I'm a board-certified obesity specialist physician who has seen thousands of patients on these medicines and have overseen tens of thousands if you include the doctors who have been under me at the various clinics. I've also done research into this specific topic, so let's talk about it. This ex-user brings up the headlines that he's probably been seeing about the risk of semaglutide, the most common GLP-1 receptor agonist known as Ozempic for the type 2 diabetes, or Wegovy for weight management, and the risk of this non-arteritic anterior ischemic optic neuropathy. He does bring up the JAMA article that we discussed on our podcast last year, which we brought on one of our buddies who's a retina specialist, which looked at those taking semaglutide with type 2 diabetes versus those with type 2 diabetes that didn't take semaglutide. And there was an increased risk in this observational study. Unsurprisingly, he did not cite this newer analysis that did not show an association between NAION and GLP-1 receptor agonists. Now, I'm not going to sit here and say there's absolutely no risk. That's ridiculous. Now, we haven't seen it in the large randomized controlled trials, but when you start putting millions of people on these drugs, maybe there's some other types of effects that we see that couldn't be found in the trials. We actually brought my retina specialist buddy on here, who was my brother's residency roommate, and we discussed that there is biological plausibility for this to be possibly happening. The medicines do lower your blood pressure, and at night your blood pressure goes lower. And if your eye's not getting enough blood flow, potentially it could cause blindness. But the risk, if it's actually there, is extremely rare. So while I think the effects are extremely rare to maybe not even existent, if they are there, this is why I urge caution to recommending these drugs for pretty much everybody. Because if there's not a very large clinical upside, we then see these potentially negative things happening more frequently in people that just didn't need the drugs in the first place.